Great to see you all today, and thanks for taking the time. We have two incredible panels coming up. I have four of our amazing StartUpHealth health transformers on stage with me now, and we'll have another session coming up in about 15 minutes here. But thank you all for joining us. Would love to start today hearing from each of you. Most importantly, the audience needs to know who you are. So introduce yourself and tell us about your company mission. Sacha, I'll go with you first.
Yes, hi everyone. My name's Sacha Heppell, and I am the Chief Marketing Officer of SmartTab. And Robert Nischel is our founder and CEO. His background is in the pharmaceutical research and development space. My background's in marketing. I was the medical magazine, media magazine, 40 Under 40 this year. Yep.
My name is Schneier, and I'm the CEO and co-founder of Trusty.care. And Trusty.care, our mission is to ensure that no American goes bankrupt because of out-of-pocket healthcare costs. But the way we're going about that is by reducing people's individual risk by getting them into the right health insurance product. And that's what we're working on.
Great. Mory?
Great. My name is Mory Bahar. I'm CEO and founder of Personal Remedies. At Personal Remedies, we help patients prevent, manage, and reverse their chronic illnesses, not just one, but multiple chronic illnesses. As for my background, I've been around for a while. A couple of companies in the past that I worked for went public. So this is not my first rodeo. I just look very young.
Thanks, Mory. Victor?
I'm Victor Wang, founder and CEO of care.coach, and we're solving the caregiver crisis. So our flagship product, the care.coach avatar, uniquely combines the best of humans and empathy and conversational intelligence with artificial intelligence for clinical coaching, self-management coaching. So we sell into payers, health insurers.
Great, thank you. And Joseph, I'd love to ask you, also like Mory, I know this isn't your first time building a company. Would love to hear a bit about your experience with Trusty.care and what you found to be the most surprising or kind of biggest lesson you've learned, both as building Trusty.care and also in the last 2 years coming out of this pandemic.
Yeah, and I've built and sold a number of different companies, both in the educational space and more on the provider side of healthcare. And up until forming Trusty.care, I had this impression that a lot of the things that were happening to consumers, the challenges they faced navigating the healthcare system, were possibly even intentionally done by payers in the system. And one of the most surprising things in this company is realizing that on the payer side of the house, the systems that they're working with, even just internally to manage their own businesses, are just as inefficient as anything that the consumer is touching. And that if we want to really improve healthcare, we need to look at how do we improve the systems, the electricity and piping of healthcare, not just the consumer experience.
Thank you. And Victor, would love to hear from you as well. Coming out of this pandemic, can you talk to me a bit about the growth you've seen at care.coach and what that's been like the last few years?
Yeah, it's interesting because I started the company originally to solve senior loneliness, and then it's kind of was thrust into the spotlight because of the pandemic and social isolation among older folks. But we grew 5x last year in sales and headcount 3x. So it's always important that sales is growing faster than headcount. So yeah.
And what do you see now looking ahead? What are your biggest opportunities and what are you most focused on to continue that growth?
Yeah, we're really excited about Medicare Advantage. So our customers include some of the largest Medicare Advantage insurers in the country. We cut our teeth in these health plans called PACE, or Program of All-Inclusive Care for the Elderly. So super complex, average number of chronic conditions in PACE is 7.9. A lot of Americans have trouble naming more than a few chronic conditions.
Yeah.
But and just taking that to a much larger market, which is Medicare Advantage.
Great, thank you. And Mory, for you, as you're thinking about your go-to-market strategy, how are you really differentiating yourself and your company within this space, and how is that informing what you're looking at moving forward?
Thanks for that question. there are basically three things that make us different and unique in this space. There are a lot of organizations and companies that provide nutritional services, advice, and so on. One is the fact that we support dietary guidance. We provide dietary guidance for about 300 different illnesses and conditions. Most of the other organizations are pretty much limited to the most common ones, such as obesity, diabetes, and heart disease. The second thing that makes us different is that we provide dietary guidance for someone who suffers from multiple chronic conditions. According to CDC, there is a void of information for those patients who suffer from multiple chronic illnesses. And we can handle basically any combination of illnesses, medications people are taking, allergies, dietary preferences, and health goals that they might have. And the third thing that makes us different is the fact that all of this is fully automated. We represent basically world's first e-dietitian. Our algorithms and our software can capture patients and individuals or consumers' multiple illnesses and health issues and medications, and based on that combination, provide individualized dietary guidance. You want me now to talk about how we go to market, or should I yield to my younger colleagues?
Would briefly love to hear about, based on what you just shared, the differentiation, how is that informing your go-to-market moving forward?
We go to market basically two different ways, as you can imagine, B2B and B2C. In terms of B2B, we have an API, industry standard, very easy to use API that allows health tech companies and providers and wellness organizations and integrative medicine and functional medicine professionals through their platform and software and apps and other tools access our knowledge base of this kind of dietary guidance. The second way we go to market is our patient portal, which we just upgraded. So I invite you to go to personalremedies.com, click on that patient portal, and you will see how we provide dietary guidance and answer common questions as well as tough questions related to what's good for you, what's bad for you, for whatever illness that you might be concerned about. And if you find any bugs while you're doing that, just send me a private message, please, okay? And the third way we go to the market is we have 44 mobile apps each in the market, and each app is focused on one chronic illness and its common comorbidities, which is something that often industry forgets about. You can't just find somebody who suffers from diabetes. If you have one, chances are they also suffer from high triglycerides, heart disease, obesity, and many other complications. So that in a nutshell is how we go to the market.
Thank you. And Sacha, I'd love to hear from you, high level, a bit more about SmartTab and what you guys are focused on, and particularly if there's anyone in the audience, an ideal partner or collaborator, what you'd like them to know about you and what the ask would be.
Yeah, so SmartTab, what we focus on is drug delivery. We are developing the Inject tab, and it will replace the syringe and needle to deliver biologics with an ingestible capsule. So just imagine all of the patients who have to self-inject, the pain, anxiety, and stress that comes along with that. We are out to transform that with ingestible capsules, bringing advanced wireless technology to drug delivery so that we can really transform the life for patients. Who will partner with us? Pharmaceutical companies. We are looking for pharma partners who have a specific biologic drug that they are looking to move to an ingestible capsule, differentiate themselves in the market, extend patents, and ultimately provide patients with a more advanced delivery method and patient-preferred delivery method. So they would bring the active ingredient funding, we collaborate on clinical studies, and we bring it to market. So pharma partners, one. Number two is investors. So we are very people-centered at SmartTab, all about people. So now we're giving people, everyone, an opportunity to invest in SmartTab. So you can find us on StartEngine, startengine.com/SmartTab, and we'll be doing this campaign until April 30th. You can actually invest in SmartTab today.
Awesome.
Yeah.
Thank you. And then Joseph, for you, what do you wish, as you're thinking about an ideal collaborator or partner as well, what is something that, with the general hope that they have a basic understanding of the healthcare landscape, what is one thing that you wish they knew that they might not already know?
So we sell into the payer system, and particularly into Medicare Advantage payers. And one thing that we wish that a lot of them knew, and we do want to partner with more of them, is how really competitive the market has become and how much harder it has become to get in front of your potential new members, which is one of the things we really are working with them on, to both get them these members in and also make sure that the payer understands that they need to be pivoting to add new plan benefits that will really meet the needs of the healthcare population that they're serving.
Great. And as we start to wrap up here, I have a last question for each of you. As you're dreaming it up as founders and thinking about 5, 10, 15 plus years from now, say we're all back here on the stage 15, 20 years from now, hopefully we get to come back to sunny Miami again. What is the impact that you've had, that your company has had? What's the vision that you hope to achieve by then? Victor, we'll start with you.
So because our avatars are powered by real people combined with AI, we're able to gather really interesting data that nobody else has access to. So we're praying with our clients, we're talking with them about their grandkids, and we're coaching them to better manage their chronic conditions, take their medications, do their PT exercises, and so on. So we're able to build conversational AI that nobody else has the data for. So maybe we'll already have hit singularity in 20 years, but pre-singularity, we hope to transform the state of conversational and relational AI and actually help conversational AI deliver on its promise and actually serve as a friend, as a caregiver, as opposed to just kind of like task-oriented tasks that it's good at now.
Yeah, that companion. I love it.
Yeah.
Mory, what about you?
I learned a while back that when you're making short-term predictions, it's more important to be accurate than entertaining. But when you're talking about long-term predictions, it's more important to be entertaining than accurate. So with that in mind, if we fast forward 5, 10 years from now, my vision would be that you arrive at a new city and you look for your favorite restaurant, and our app knows all about your health profile, and the restaurant has all their recipes on their menu assessed by our technology, and so that you can walk in and pick what are the best items on the menu, the most helpful and healthful items on the menu for your particular individual situation. That is something that from a technology perspective, it is definitely within reach. We already have partners who have assessed 5 million recipes in their database using our technology and knowledge about individual ingredients, and they can determine what recipes are best for this person who suffers from a combination of polycystic ovary syndrome and has a history of breast cancer and so on. So from a technology perspective, we can do that. It's just a question of adoption of that technology, both by various restaurants as they become more sensitive to our individual health, as well as consumers who are also on track to becoming much more sensitive and pay more attention to what they eat.
Thank you. Joseph?
So in the next 5 to 10 years, what we'd really like to achieve, and this may not be what most payers like to hear about, is that people don't have to think about insurance, that it just works on their behalf. So then when they need access to care, they're in the right plan, the plan is meeting their health needs, and it's not something that they have to even think about. So that's our dream, is creating efficiencies that we can get to there.
Thank you. And Sacha, to wrap us up.
Yeah, 20 years from now, long way, right? So think about this for a second. 16 billion injections happen globally every year. If SmartTab is the one company, part of StartUpHealth, that could touch every person out there. And 20 years from now, every pharmaceutical drug product, biologics, will be delivered through a wireless, ingestible SmartTab capsule. That's our vision, and we are going to increase adherence and create a better experience and better patient outcomes. SmartTab, that's the vision. And StartUpHealth, the mission, that's our mission too.
Yeah.
We're out to truly touch every single life.
Yeah, thank you. And
Thank you.
thank each of you. Here at StartUpHealth, we're excited to watch these visions happen and look forward to partnering for many years to come. So we can all give them a round of applause. Thank you all.
Yeah. Thanks for listening.
Thank you all.
Yeah.